Hey YouTube, I'm your fave nurse B. Today we're going to talk about NCLEX, specifically how you can find out what is going to be asked on NCLEX, like as far as what part of nursing is going to be on there, as well as how you can use past NCLEX tests, like if you do practice tests, how you can use the information from that to study for NCLEX. So the book that I used for NCLEX was Saunders. These tips are good if you're going for your registered nurse or if you're going for practical nursing. So the first things first, of course, get you an exam book. And if you look in the front, pretty much, I'm sure every exam book in the front of it is going to have an explanation of what's NCLEX, what's on NCLEX, yada, yada, yada. Read through that because it's going to give you information about like how test day is going to be, how you should prepare for NCLEX, how you should approach NCLEX. So look through there and you're going to find more than likely a breakdown of how many questions you're going to get from each section. So I'll go more into detail throughout the video. So that's that. So use this as a tool to study, because the biggest way to study for NCLEX is to make sure that you're prepared and you're going into the test have an idea of what is going to be on it, have an idea of what they're going to ask you, and just not being so completely like overwhelmed by it. You have, in order to tackle NCLEX, you have to demystify it. So the best way to do that is to just learn about NCLEX and learn specifically what they want you to know. So without further ado, we're going to get into the video. So if you look at the front of your book, usually it'll be in the front like exam prep, something like that. It'll give you an idea of how many questions you're going to get from different categories on the NCLEX exam. So with this is the client needs category, and these are the different subsets of that category. So coordinated care, a part of coordinated care is making sure that it's going to ask you like a question like you come on your floor and what patient are you going to see first? The patient that's post-op and bleeding, the patient who has CHF and whose oxygen saturations are at 91, your patient who wants a pain pill, or a patient who just fell on the floor, something like that. So you have to prioritize who you're going to take care of. So that's coordinated care encompasses a question like that. So I just wanted to show you all that so you kind of get an idea of where a lot of your questions are going to be coming from. Safety and infection control, that's a big thing. Health promotion and maintenance, that's basically like teaching your patients certain things and making sure that you are consistent with what you're telling your patients that they should do, as far as when they leave the facility, that type of thing. Psychological integrity, that it has to do with psych, and then physiological integrity is more so the physical things that you have to do as a nurse for your patients. Okay, so that's all that. Now let's get specifically into a practice. So this is a practice test I did, and let me find the date on it. So it was done. Oh, it was on another piece of paper. I had it. Anywho, it was June of 2014. So that was like a few months into my nursing school. I think it might have been right before we started fundamentals, or like right in the beginning of fundamentals. But anywho, on this particular website, they break down after you do the test questions, and so you put in that you want to do about 25 questions on fundamentals. It'll break down this little worksheet showing you what percentage you got right and what percentage you got wrong. So I only did it on fundamentals of nursing, and then with fundamentals of nursing, this is the way it's broken down into these subsets. So but NCLEX will test you on fundamentals, pediatrics, psych, get it, then the nursing process. So even if you're only doing questions on fundamentals, the nursing process is always going to be within it. And then also these client needs categories that we just looked at, that's going to be in there too. So you can see my total score, 32 out of 50, was only 64. So, well, to pass each nursing class at my school, you had to at least get a 75%. So they wanted us to at least get a 75% on all of our NCLEX questions, so that we know that at least we're right there where we need to be to pass the class. So If you're looking for NCLEX, I would say try to at least get 80 to 85% so that you're okay when it comes to NCLEX. So as you can see when I come over here, so I did pretty good with basic physical care, but the one I had the most trouble with was basic, what was that? The nursing process. That's where I had an issue with, the nursing process. So if I come down here and look at the nursing process, I see that the one that I had the most issue on was data collection or assessment, depending on how you want to look at it. So what I would do is I would go back in and look up specific questions about NCLEX prep questions, data collection, nursing process questions, data collection questions, and then try to bring that up. Okay. And you see the other categories, of course, are all 0 because I didn't specifically look for questions on that. I only looked up fundamentals questions. And then if I come down here, let's see. If I come down to the part where I said NCLEX really looks at the most is, let's see, health promotion and maintenance. So my patient teaching, I need to work on that. Because I had 3 questions, but I only got 1 right. So that put me at 33%. So that's what I need to look at. Let's see, I had to cut it off. The next one I would look at is probably physiological adaptation. Look at those questions. So of course you want to look at anything that's less than what you are giving yourself as far as a benchmark. So say I wanted to at least get 70 on all these questions. I look at anything that's less than 70, but I probably would start with the one that's the very lowest and go from there. When you look at the one that you have the least for, just keep doing those questions over and over again. But this website is really good because it breaks down everything for you. And this is how NCLEX is going to test you. They're going to test you on these different categories and all these different subcategories. So it's really good to do questions, you know, on that. And then you can do more specific questions. So say for instance, I was doing peds and I did really good on everything but toddlers. So I really need to start focusing on more toddler questions. And then when it comes to a point where I just completely, I look at the rationale, I don't understand it, like this is too much, then I need to look up that specific thing that's going on in that question and look it up in an actual textbook and read about it. And then, or look at a YouTube video about it. You have to make sure that you're not just answering the questions just to answer them and get that question right, but that you understand what the concept is behind these questions that they're asking you, okay? So this is just a little example for you all to help you. I hope that that helps for you to look, so you to be able to look at what your actual results are and break it down and see where you need to focus more on for NCLEX. And then you can also use this same process when it comes down to studying for a specific subject in school. So that's that. Okay, you all, thank you all for watching this video. I hope that it was really helpful for you. I have more videos in this series on NCLEX Success, so check them out. Thanks for watching. Peace.